So let's see, our first question here is, the community would like to know, when will there be an updated roadmap shared with the community? What's next on the list and how long will it take to complete?
Okay, I think I take this one. Before I start, I would like to say thank you very much for very warm introduction. Yeah, to make it very short, the question aims to get the updated version of the of the roadmap, and I think looking at the homepage, we have already a very accurate one, which we do not see any necessity to change it, and we certainly be delighted to communicate any changes if necessary. The current milestones and packages we are working on are certainly on the web page, and we are on track.
Okay, great. Thank you for that.
Welcome.
So our next question, can you provide more up-to-date information related to the organization and product development, perhaps weekly or twice a month?
That's a great question. So we currently send out weekly updates in regards to the company. With that, please do reference our roadmap that Mohsen just mentioned that can be found on the ptoy.org website. As we, reach the point of release to the public, you would see definitely more updates in regards to the technology as we implement and make those changes according to usage by the public.
Okay, great. Thank you so much for that. Our third question, please share details about the foundation and each of the new team members. Is the purpose of the nonprofit to avoid taxes?
Well, what I can share with you, the team members are exciting guys, and I love working with them, and we are getting every day more. Regarding tax, I think that is not the matter why we have this organization in this form and structure we have. It is a very usual approach and organizational structure in Switzerland and around the world. And I guess many companies sitting next to us, they have the same structure because it makes sense. And by the way, this is a very good structure to protect the money our investors actually put in place in order to get a great development. We are separating basically the development organization from the sales and marketing organization in order to spend the money for the innovation and for future developments. So we look at that, where to spend how much, and we want to reach really what we want to deliver to the market. And I personally am very stingy to spend that money because I want to deliver what we promised. That is why we made this separation.
And also to add on, we are dealing with private health information around the world. So having it in a country that's neutral, such as Switzerland, in a foundation where it is not owned by, it's not centralized, it really gets to the true nature of blockchain, decentralization, and distribution.
Exactly.
Okay, great. Thank you so much for that. Let's see, next. Are you hiring an internal team of developers, or do you plan to continue to outsource these roles? If so, when will you hire internal developers?
Yes, we have internal and external developers, and we will not be hesitating to involve experts with great expertise who can help us to be fast and up to our delivery, to deliver what we are promising to the market. As you know, we want to be really fast, and the speed is very important. And if necessary, we will change the direction and have the people inside helping us in the company. And yeah, this is a hand-in-hand work together with our partners to have a huge impact in the society.
Okay, great. Thank you for that. Next question, can you share details on the pilot program? Have you started, and with whom if so?
So if you look back at our roadmap, you know, that pilot won't start until late summer. Our goal right now is to continue running tests on the technology, make sure it works with the partners that we do have today before, you know, going forward and going into production.
That leads into our next question. Are there ongoing partnerships or partnerships in progress of which no one knows?
So that's a great question. We do, and this is also in reference to, you know, our pipeline. We do currently have signed memorandums of understanding that we're currently working with partners to get to a project proposal. And once that's agreed upon and they actually agree to have that publicized, we will share that with the public.
Okay, great. Thank you. So our next question, do you aim to partner with the big players or just aim to partner with the big players such as hospitals, prominent healthcare organizations, et cetera, in the healthcare section? Or would you consider partnering with private doctors and universities?
Yeah, again, another good questions. To make it short, we are looking at big players first. And that is our aim, because we would like to really integrate the data and have the patient information in one place and go for the next steps. And this is where we can get the big data. Of course, universities and doctors, there are those customers and people we are talking at the end. But again, we are approaching the big players. Teresa, if you want to add, please feel free to do that.
Oh, absolutely. You most hit the nail right on the head. We see also big players as the ones who are actively doing work and research in terms of their R&D budgets around blockchain technology. So at this point in, you know, gaining those early adopters, it makes sense in working with those larger organizations and institutions.
Okay, thank you. Next, can you talk about the 8 pilots that you have in the pipeline for extensive validation and proof of concept testing?
Yes, as I mentioned earlier, these are, you know, majority of the memorandums of understandings we have that we are currently working out our plans of proposals to move forward with.
Okay, great. So let's switch, I guess, the questions here just a bit. We have some related to the technology and things of that nature. So are people using Ptoy in the D app or just trading it?
So I just want to take a moment to step back and explain the difference. So we have the Ptoy blockchain, which is governed and owned by the foundation in Switzerland. And then Ptoy Inc. is, you know, the one in charge of manufacturing and releasing the distributed application that is built on top of the blockchain that allows patients, but also their caregivers and other key stakeholders to gain access to this data. And in order to gain access to this data, we actually need to have the Ptoy tokens, which functions as a utility tokens to retrieve access and storage of that information on the Ptoy blockchain.
Okay, great. And that leads us to our next question. Can you discuss how to use Ptoy with the app and the wallet?
So as I mentioned, you know, Ptoy would function as that entry into the blockchain.
Okay, great. So our next question kind of continues with the technology. How many Ptoys are needed to buy storage and to execute smart contract payments and transactions?
So this is also a good question. It's also variable in that it depends on the amount of network storage space you actually need for a particular usage. And it also is variable, similar to other, you know, concepts out there currently in terms of file storage using a token. It depends on, you know, the necessity for the token usage at the time in the market.
Okay, great, thank you. Can the community or patients access the Ptoy ecosystem using a fiat currency?
Currently at this time, we are limited to our Ptoy tokens, but that is something that we will consider for future releases.
Okay, great. So that leads into our next question. Is the private blockchain ready? If so, what's next?
So the private blockchain is completed. As we mentioned, we're working really on testing and proving the true nature of that. And as next steps is to, start creating a network ecosystem of healthcare nodes on the blockchain.
Okay, great, thank you. Will you consider incentives for launching on the new blockchain?
So I'm not sure of this particular question. So when you say new blockchain, I am thinking of our blockchain and incentives of launching. So that is something that is in our product roadmap for other distributed applications to be able to integrate and launch on the patient portal network. And of course, they're to build incentive models around that.
Okay, great. Okay, great. Now we kind of jump into a few different scenarios, but they're in the form of questions. So how do you plan to approach international health insurance for those traveling abroad for months at a time, in addition to those traveling abroad for activities such as surfing, rock climbing, snowboarding, etc.?
Yeah, I will start, and please, Krista, feel free to add. I think, I have also, to be honest, a little bit problem to understand it, because we are not an insurance company, and this question is maybe valid for an insurance company. But if the question goes to the direction of whether we are going to work with insurance company in the future, looking at really, artificial intelligence and creating benefits and services on top of, based on electronic health record, yes, we are going to do that, but it is too early to talk about that. That is version 2 or 3.0, and that is the exciting part of Patient Tree, why we believe we are the best, and we are the best company to work with.
Krista, did you want to add to that?
No, absolutely, I agree. I also think, we've been thinking about the many use cases in healthcare. Insurance is one, and working with partners in the insurance space, we can develop a lot of these different incentive and models, like travel, that can be applied in the smart contract usage of an application.
Okay, great. Thank you both for that. So next question, what makes Patient Tour unique compared to other healthcare projects in the same space? Have competitors beat you to the punchline and develop a full product first?
Oh my God, she's asking a question. I could talk about that 3 hours, and this is why I joined this company. Krista, please, you start first before I get disqualified.
We have extra time.
So I can start by saying, healthcare is an over $3 trillion industry. There's, room for everyone. In terms of our competitors, and if they, currently there isn't a, large scale enterprise healthcare blockchain solution that is currently on the market to date. Everyone is really in the proof of concept and pilot stage. And what really differentiates us is, our focus on bringing true interoperability to the systems and integrating, with these monstrous large healthcare systems that are siloed and centralized.
Yeah, I may add a very short sentence before. I don't want to talk long about that, but I think having data being connected, having connected data based on blockchain technology, which is the future, that is one thing. And as Krista rightly mentioned, there are many companies around us, they are also in pilot and they're working very hard on it, from startups to big companies. But what do we do with this data? And how is this journey going? And that is the big question we're all asking ourselves, and we have at Patient Tree great plans for that. And this is why I personally believe, this is why we are unique. This is why we are traveling around talking to everybody. This is why we are exciting everybody around the world after presenting our concept to them and the future vision. And I would be available for any conversation when it comes to artificial intelligence and agents who are trying to detect the sickness of people, diseases of people, and recommending them special treatments later on, while involving the care provider, while involving the insurance, while involving, while using the behavioral economics. I would be happy to talk to people regarding these topics, and I would love to talk about that. But I think this is the only thing I wanted to say before I get again disqualified. Sorry.
No, we do have a few extra moments, so thank you for that to the both of you. So we have 2 additional questions, and then we'll open the floor for any questions from our audience. So the next question is, what are Garnier's day-to-day tasks? Garnier is our operations, director of operations. So I believe Krista will answer this for you guys.
Yeah, so Garnier, as kind of mentioned, our chief operation officer is tasked with, the daily functions of the business. So ensuring that we are legally compliant and that we're up to date with our registries, down to payments and budgets, etc. Any really operational task that goes on in the day-to-day organization.
Okay, great, thank you. And our last question before we dive into any additional questions from the audience and from our community, how close is the team with the advisors? Do you meet on a regular basis? And do they offer guidance to the company?
So our advisors are pretty close. With me, I meet with them. It varies dependent on the need of the advisors, and each one has, a different function. So we meet at least once a quarter. Others, we might have weekly meetings, while some it might be once a month, or I'll just pick up the phone and chat with them dependent on, the need of the company at that time.
Okay, great. Thank you so much for that. Now we have a little less than 10 minutes remaining, so we'll open the floor for additional questions. And Kelly is actually assisting with filtering the questions to us. So the first question is, do you recommend any specific exchanges to purchase Ptoy tokens?
Yes, currently we're on a couple of exchanges. I know Bitrix is one, and I've heard that they aren't taking new people to their platform. But, you can also go to HitBTC, is another exchange that we are located on. If not, we're also available on Changely. You can easily change any of your crypto assets into Ptoy.
Okay, great. Thank you for that. It looks like we have one additional question. And again, we do have a few more moments. So if there are any questions, please post them in the chat box so that Kelly can filter them over. But the last question so far, it looks like, do you intend to achieve ONC certification for health information technology?
Yes, as we look at the US market, ONC certification is one of those deliverables. In order for us to work within, U.S. constraints with the Department of Health and Human Services.
Okay, great. And it looks like I'm able to see a few additional questions here, which I think it's a great segue into details about the Health Summit. So can you guys give us some information about the upcoming Patient Tory Stiff Tongue Summit?
Great, and I'll also let Mohsen add on after, but this is, really our inaugural event to bring together, blockchain healthcare enthusiasts, developers, individuals who are interested in learning more about, what's going on currently in the industry around blockchain, products that are products that have already been released, how are they working? It's really, geared towards, to build a community and to educate, everyone around blockchain and how its use will be in healthcare for the future. So that will be on May 31st in Atlanta at the Four Seasons Hotel. And it's, really significant point because it's a year after, we actually went live with our token sale.
Yeah, I think I can underline what you said, and it is going to be exciting. The team is working hand in hand together to make a real show, very nice, so we can really meet each other and share knowledge and information, and yeah, and continue to learn from each other, I think.
Okay, great. Thank you so much for that. And you can also view the additional details at ptoy.org under the Summit tab. So we'll have a full list of the agenda, the speakers, for anyone that's interested in joining us and or reading about the additional details. So it looks like we have a few additional moments remaining. We have a couple of more questions that have filtered in. And I believe these will be the last questions for this evening, or for this AMA, this morning. Why, I guess the question is, why would a healthcare related company invest in Ptoy tokens? So Krista, can you kind of give us a little additional background about that?
So a healthcare company, I don't think, doesn't actually invest in Ptoy tokens. If I get the question right, you're asking why would a healthcare company use Ptoy? So they are actually, integrating their systems into the blockchain network, and then Ptoy is that functional code that regulates the actual storage space of the network. So it's not that a healthcare company invests in Ptoy. It's more as if they're using the infrastructure and the network which the Ptoy token governs and regulates that network.
Okay, great. So we have an additional question about the product. The community would like to know if the demo itself is just an idea, if it's a real product, and or when will they have additional information about the back end and see the actual app?
So the demo was, the wallet, the patient portion wallet of the app, which will be released, before our inaugural summit on May 31st. So definitely stay tuned, read our weekly updates as we, continue to send out more information regarding that. But that demo was, was able to show you, the work to date in getting that true interoperability, as I mentioned before, with a lot of these legacy siloed electronic health medical record systems.
Okay, great. So I'm just looking to make sure we don't have any additional questions. And to answer, there's a question about if the session is ending now. So our AMAs are typically 30 minutes. So I think there was a typo there. So this AMA will end at 11 a.m. today, and it's available for review. We'll post it on the various social media channels. And I think there was one additional question, just to confirm if there's any additional background information on when the app will be completed and when consumers will be able to download that product.
So that is also part of that product roadmap. As I mentioned before, we will be doing a private release before May 31st. So definitely look out for the newsletters when that will be released.
Okay, great. And I believe that brings us to the end of our 2018 Q1 AMA. Thank you so much for everyone that joined. Thank you, Krista. Thank you, Mohsen, for answering all of the questions. And we will post this video on the various social channels for everyone to enjoy and review. If there are any additional follow-up questions, please feel free to post in our Q&A section on Slack, or you can send them to us directly at info@patienttory.com. Thank you so much and enjoy your day. Bye-bye.
Thank you.
Thank you.
Thank you for having us.
Thank you.